You may know our next guest, Christy Turlington Burns, from the runway, because she was knockout on that place, but she's also the founder and president of the nonprofit Every Mother Counts. So this group works to provide health care access to mothers around the globe. Christy became an advocate after suffering life-threatening complications during the birth of her daughter years ago. Her new documentary, Perilous Passage, I love this title, Birth in America, explores maternal health care following the end of Roe versus Wade. It's produced by See It Now Studios, a division of our parent company, Paramount, and the great Susan Zerensky. Here's a clip.
Why is it that in one of the wealthiest nations on earth, so many women are at risk of dying in childbirth?
The U.S. has the worst maternal mortality rate of developed countries.
It has become epidemic that hospitals are shutting down, especially in rural America.
I look at Brooke's heart monitor and it is flatlining. What went wrong? How did this happen?
Very few people even seem to care how hard it is for these moms with no options.
What happens if you have a complicated pregnancy that won't survive?
Well, a lot of people do care. Christy Turlington Burns is one of them. Christy, it's so good to have you here.
Thank you.
From model to mother to maternal health advocate. And this is the thing that got me. I know some of these statistics, but just hearing it again in the documentary is shocking to me. It's so well done. Start us with the statistics that I want people to grab right away about how bad this is.
2 women die every day in this country from preventable maternal mortality or maternal complications. Black women are 3 times more likely to die than their white counterparts, and Indigenous women are right behind them. This is preventable. For over 80% of these deaths are preventable, and we know what to do to save them.
80%. Now, you tell the story because you could have been one of those people that died, but because you have great health care, you did not. And now, what is it that you want people to know?
I mean, I really want people to understand that we already are. The U.S. has been in a maternal health crisis for many years. However, it's gotten worse, in fact.
Why? Why? This is what I don't understand. Why?
I know. I mean, it's more dangerous to become a mother today than it was a generation ago, which most people are shocked by. I mean, it's hard for women to access quality care. Hospitals are closing every day. A lot of women in this country live in rural areas, so they're far away from care. And if a hospital closes and they don't have any other place to go, no relationship with a provider, less doctors are going into the field of obstetrics because of this post-obs world that we live in, which is dangerous for doctors to provide care in the way that they should for the whole person, and whatever is they're dealing with as opposed to birth alone. It's a scary time. It's a very scary time.
In the documentary, you show a short video clip of yourself giving birth and then having a complication, which is a complication that my wife went through similarly. But we had the best care in the world. You had the best care in the world, and so you survived, and Marion survived. Most people do not have that access to care, and the statistic that matters is that we are an industrialized nation. Yes. We are the only industrialized nation with the statistics that you mentioned. And so there's one woman in Wisconsin whose story particularly touched you. Tell me about her.
I mean, they all touched me, but really, Megan Kling is one of the mothers in the story, and she lives in a rural area of Wisconsin, and her 3rd pregnancy ended up being an anomaly pregnancy. You know, anything can happen at any time in any pregnancy.
Yeah, the first 2 went very well, so she wasn't worried at all. Yes.
Exactly. And when she learned that something was wrong with her child and they were under fetal demise, the provider had to look around and say, what can I do? What am I able to do? What am I legally allowed to do? And she had to leave the state to Minnesota in order to be able to have care that she needed to save her life and make sure that her experience was not as traumatic. I mean, it's traumatic no matter what, but to help her in that moment. You know, it shouldn't be that way. Women shouldn't have to leave that quickly or to travel that far when they're under such circumstances. It's terrifying. It's hard. It's scary to be pregnant even when you're healthy and even when you have all the things.
Yes.
But when you don't and you have to also travel 7-8 hours to get care, it's terrifying.
Why is it higher for black women, even black women who are educated? This is the other thing that got me. You think, okay, if I'm educated, I know exactly who the doctor is.
And I have means.
And I have means. It's higher. The death rate for black women is higher, even educated black women.
Exactly.
Why?
There's a lot of bias in our medical institutions, sad to say.
So?
You know, providers are not trained to care for women of every socioeconomic background. They make assumptions, they make judgments. There's a lot of blame, and if women come late, it's just a lot of things that would deter someone from seeking care in a timely way. But even when you're in the facility, if a black woman complains about pain or reacts in a way that makes the provider nervous, they just judge them, put them in a corner, don't listen to them. And there's so many stories and reports of women who have not been listened to.
Yeah, some people think that black women have a higher tolerance to pain. I know that is just not true. You're not heard.
You're not heard, and you're discriminated against. And so there's been a lot of efforts to sort of train providers to be much more welcoming and supportive and compassionate. I mean, it feels like a given, but it's not.
Yeah, well, I have to say the documentary is powerful. You were so good at it, too. Didn't you think the way you go and you interview people, it's like I feel like I'm sitting there at the kitchen table listening to you talk. What should we do? In less than 30 seconds.
Well, I think this is an important time. Mother's Day is around the corner, right? This film just came out. I want people to see it. I want people to understand that maternal health is a human right.
Yes.
Every aspect of maternal health. We need to meet women where they are. Yeah. This is pro-family, this is pro-woman, this is pro-health, and we need to care for
Every mother counts.
Every mother counts.
Yes. Thank you, Christy Turlington Burns. We appreciate it. Perilous Passage, Birth in America is streaming right now on HBO Max.